If you're just joining us, this is Good Morning Abuja on NTH and I5, the Unity Station. This time we want to discuss mental health and substance use disorders. Okay, we have Dr. Emmanuel Ango in the house. Please join me as I welcome him to the studio. Good morning.
Good morning, madam. It's a pleasure being here in your program.
Thank you so much for joining us.
Thank you so much.
Thank you. Okay, let's look at we're looking at mental health and substance use disorder. Let's look at the connection between the two of them. What's the connection?
The connection is very strong because when we talk about substance use, we talk about substances that people use, things like marijuana, alcohol, crack, cannabis, heroin, injectables. So these substances, their primary site of action is in the brain.
Oh.
Yes. So they exert their effect by acting on the brain. And we know that the brain is like the master organ of the body. It controls our behavior. It controls a lot of things. So mental health, these things affect mental health in the sense that it alters the way the person thinks, the way the person perceives his environment, and the way the person behaves.
Oh, okay.
Yes.
Okay.
So sometimes the person can, behave in a way that becomes a nuisance to himself and the society. Might not be able to function well in his job, might not be able to relate well with his family and other people in society.
Wow. Okay, what are common signs, Let's look at the common signs and symptoms that the person begins to exhibit for one to know that this person is having such an issue.
Well, most of the time, the people that engage in substance use are very secretive about their behavior. I mean, they're very secretive. You might not know initially, especially the teenagers. No teenager would like his parents to know, most of them. So, but some of the early signs are like, secretive behavior, spending, stealing to fund the habit and that. Then later we see frank symptoms like what we call psychosis, when the patient now starts to exhibit odd behaviors. No more cares for himself. There's poor self-grooming. They don't function well. Maybe their academic performance in school starts to dip, or a person at his job, absenteeism, lateness. You understand? Then the worst case scenario is when you see somebody actually exhibiting frank symptoms like talking to self. Those are exhibiting hallucinations. Some of them can be what we call manic. That is a mood whereby the patient is so elevated, the person acts irrationally, spends irrationally. So these are some of the symptoms, of substance use.
So how can the stigma be managed? A lot of people, once they hear that this person is into drugs, or the person is is recovering, let me put it that way, there's always this stigma. How do you think the stigma can be managed?
Yes, the stigma is a big problem. Why a lot of people don't want to seek help, because automatically the person is deemed as wayward. A lot of privileges are denied the person. The person can lead to loss of job. It can lead to relationships. If it's a marriage, it can lead to problems in the marriage. So this stigma can be avoided when we try to understand that this is an illness. It is an illness, just like any other illness, but this one affects the brain. So these are people with potential in life. There are some. We try to find out why did they even go into it in the first place. Some people use it as a coping mechanism for stress, and
depression.
Depression, and we know what we're going through, an economic downturn and everything. But a lot of times, the younger people do it out of curiosity, peer pressure. When they're growing up, they want to belong. They try it. They want to see what it's all about. So I usually tell some of my patients that a mistake does not define a man or person, but being able to correct yourself and come
out of it.
That is what makes you a human being and somebody that achieves goals.
Okay, let's look at the recovery process. For you as a doctor, what do you, or for you, what do you think can be the recovering process or way to help the person to recover? What are the steps?
Well, the steps, it starts by motivation. You have to motivate the person. The person must be willing to accept help, and the person must understand how this substance is affecting his or her life. How it's affecting your finances, the person's finances, how it's affecting his relationship, understand? How it's affecting his own health, personal health, because these substances have harmful effects on the organs of the body, like the kidney, the liver, the lungs, and for those who inject, they are prone to many other diseases, transmissible diseases from HIV to hepatitis, So when you make them understand that this is a danger, because that is that when you have dependence on these things, you see how this is disrupting your life, you make the person understand. Then after then, when the person is fully motivated, we now talk about maybe detoxification.
Okay.
Detoxification, we now try to reverse some of the immediate effects of the substances in the system. And then we now talk about rehabilitation. Yes, we now try to integrate the person back into society and a normal life, teach him coping mechanisms, how to cope better, to cope with withdrawal symptoms and cravings, because this is an addiction. It's an addiction. So sometimes if you don't get these substances, they experience what we call withdrawal symptoms. So we teach them how to cope with this, and then we go into the maintenance phase after it has been achieved. Yes, relapse is a very big problem with substance use. So sometimes this person might be able to go through all these phases, but at the end of the day, when challenges come, they find themselves going back. So some specialists have termed this as a chronic relapsing disorder.
Okay.
Yes. So it's not strange, but a lot of support is needed to manage this kind of challenges.
All right. I think Doc will go on a break, and when we come back, we'll continue our conversation. Okay, this time when we come back, we'll begin to look at the role of families, community, and the society at large in helping people who are into this drug use. Okay, we've been discussing mental health and substance use disorders, okay, and we have Dr. Emmanuel Ango, okay, trying to explain to us what we should do and then how we'll be able to help those who are going through this. The program is still Good Morning Abuja. Please don't go anywhere. When we come back, the conversation continues. Welcome back. Yes, Dr. Emmanuel Ango is still in the house. Okay, doctor, this time, how do you think families can help the society, communities? What role do you think we can play to help someone who is abusing drugs or someone who has mental health as a result of the substance use disorder? And then especially those who are recovering, what do you think we can do? Let's start with the family first.
Yes, the family is the nucleus of all society. The parenting is very, very important. You should always have conversations with your children. When you notice strange behaviors, let them open up to you what they're going through, peer pressure and all that. Then the society too, when we see people that have substance use disorders, they need a lot of empathy. Okay. They need a lot of understanding. We don't look down on them, so to speak.
Yeah, so they need help.
They need help. They need help. Some of them don't know better, and some of them go into these substances due to challenges, poverty. Some tell you that they've not had anybody that loved them or cared for them when they were much younger. So if you notice, most of these substance abusers, they have their own special bond. They tend to bond to each other. They find solace in each other, So stigma is really a big problem, in dealing with such challenges. But a lot of NGOs, I see a lot of NGOs have been doing a lot of work in that direction.
Okay.
Yes, but we as individuals and society, we should first of all see them as human beings.
Okay.
Even though they have this challenge, and support them.
Okay, what do you think the government can do? Because I believe that, just like you said, maybe from the parents' angle, there's a failure somewhere. There's a gap. Okay, what about the government? What do you think the government can do for us to be able? Because if you look at it, let's just be honest, it's just too rampant here right now in Nigeria. A lot of youths, So, what do you think the government can do to enable them to channel their energies to positive youth?
Thank you. Yes, the government has a big role to play, but we also know that there's a lot of constraints, But bringing up facilities, facilities to take cater for this such people that have substance use problems, is very important. Then supporting in terms of rehabilitation.
Okay.
It's funding. It's funding. It's all about funding. We have a lot of agencies that are doing a lot of work, like the NDLA. So these are all NAFDAC. I'm sure too. They're talking about discouraging the young people from using all these things.
Okay.
So the government has a really key role, and then also training of people. It's everybody's business, because once one person has a substance use disorder, a lot of people, it is a chain reaction. People around the person suffers, family suffers, the person himself is no more productive. So government can do a little more, but we all know they have their constraints. But I think we have enough agencies that are by government on ground. And maybe it's to ramp up the awareness, particularly go into the society, the hinterland, where all these
also monitor those who bring in these drugs, because there are people
in fact, those people, that is where, in fact, one of the biggest issues, if we can get strong legislation against those people, not against the users, because all the time, yes, once that supply is cut off,
suppliers.
But it is it's a multi-billion naira industry. We know what is happening even in the US. This is what is even bringing the society down. What most say are on here, So if we can go after the source or limit it, because I think it's almost impossible to stop them completely. But if we can limit it to the barest minimum, it will go a long way.
Okay, let's look at effective treatment approach. As a doctor, for someone who is into drugs, as a professional, what are the effective treatment approach you think can be used for such?
I touched on that earlier. As I said, the first thing is to motivate the person. We counsel the person, make the person understand how this substance use and drug use is affecting his or her health, how it's affecting his or her finances, how it's affecting his or her relationships. And then you make the person see that, look, you have a better life when you don't use some of these things.
And then the dangers of what
to the health, to the individual, the organs, Yes, it's very, very important, because, as we age, the body system, weakens. And if a person is abusing substances, this aging process is faster, the damage is quicker, and the complications are very...
And they are prone to sickness?
Yes, from mental health illness, they're even prone to other infectious diseases, from lung cancer to HIV, hepatitis, so many conditions, even other non-communicable diseases.
Okay.
Yes. Yeah.
Okay. Now, for someone who is abusing drugs right now, as a doctor, especially our youth, I learned there's not even only youths that abuse drugs, not even adults do.
Yes. So, starting from their youth, so they take it into adulthood. It's a habit that is formed from early stages most of the time. But usually it's rare for somebody who has not been doing drugs when during his younger days and then in old age, you know.
Okay.
It's rare, but it can happen.
Wow.
And it depends on the drug involved. Yes.
Okay.
Yes.
Okay. Before I even ask the final question, I wanted to ask you: have you come in contact with people with drug addicts?
Of course.
Okay.
I've come across in contact with a lot of them. You know, even in fact, there's this drug, pentazocine. It's a painkiller.
Oh.
Yes, there's some drugs that actually have good use. You understand?
But they are being abused.
They are being abused.
Oh.
You know, they have these addictive tendencies. So that's why, as much as possible, we advise people not to buy drugs, you know, without prescription.
Okay.
You know, and then also to advise all those unscrupulous pharmacies that sell these medications, you know, without prescription, even though they know they're harming people. You know, please. You know, it's an appeal.
Because of their own gain.
Yeah, just your gain. How much you're making, but you're destroying somebody's life.
Wow.
Yes.
Okay, so what advice, your final words to a youth that is watching you, that is struggling, you know, battling to come out of drug addiction, or that is going through the recovery process? What would you say as a doctor to that youth watching?
You can do it. You can stay off drugs. You can be clean. You don't need to do drugs to be happy, or you know, to achieve whatever goals. You understand? So there is a chance for you. As long as you are alive, there's that golden opportunity for you. So retrace your steps and seek for help. Talk to people. Look for professionals, people that can help you and guide you on how to overcome these challenges.
Thank you so much, Doctor. Thank you. And I also lend my voice also to say to those who are fighting drug abuse, look, I want you to see the drug as an enemy who has come to destroy you. So you need to fight. What happens? You need to destroy that enemy before the enemy destroys you, okay? Remember that you're strong and call for help. And then for those who are going through the recovery process, please, all hands must be on deck, the community, the family, the society, to help the government, to help them come out of drug abuse, all right? Okay, we're going on a break, and when we come back, the program continues. Please don't go anywhere.